Good morning, good afternoon, good evening to you, wherever you're tuning in from. Welcome to today's Facebook Live Neurology for Vets webinar series. Thanks to Hallmark Veterinary Imaging for sponsoring this session. This is the last session of the year, so we won't be seeing you again until 2024. To those who haven't watched these sessions before, we are proud to be able to offer a platform to the rising stars of the profession to discuss their recent work, their recent publications. And today we welcome Dr. Daniela Farker. Hello, Daniela. How are you?
Good, and
Great.
you?
Great, thank you. It really is our honor to have you here discussing your work. Before you get started, I wanted to give you a brief introduction to everyone who's listening. In 2017, Daniela graduated from, and let me try to pronounce this, Justus Liebig University in Gießen. Is that correct? Yeah. Okay. That's a good start. Okay. From 2017 to 2021, Daniela did a residency at Department of Neurosurgery, Neuroradiology, Clinical Neurology, Small Animal Clinic in Gießen, and became a diplomat of the ECVN in 2022. Currently, Daniela is working at the Department of Neurosurgery, Neuroradiology, Clinical Neurology at the Justus Liebig University in Gießen. Hello to all the team there, Dr. Martin Schmidt and all the team. Hello, Daniela is going to be representing you today. And today we're going to hear about the risk factors, treatment, outcome in dogs and cats with subdural hematoma and hemispheric collapse after ventriculoperitoneal shunting of congenital internal hydrocephalus. Long title there, important practical work though. But so again, welcome, Daniela. I'm going to hand over to you so that we can hear all about your study.
Well, hello everybody. Thanks for joining that journal club, and thanks for the kind introduction and for reading that very long title, so I don't need to repeat that again. And we can start with the introduction. So the internal hydrocephalus is the most common malformation in humans, dogs, and cats, and they all share very similar complication rates. So it's about 25%, but these complication rates do not reflect the different complication types. So over the last 20 years, not decades, we tried out a bunch of complications for you. For example, you see the hemispheric collapse over here, and ventricular catheter obstruction on the other side here. These two are very nasty complications to treat. But we have other complications that are stunning sometimes, like we all know that puppies tend to grow, but some grow too long, like dachshunds, for example, who managed to get rid of their ventricular catheter, as you can see here with the displacement of the catheter. And sometimes if you put too many knots inside your system, it's not able to flow as well. So you shouldn't just do it. We wanted to concentrate on the hemispheric collapse today. And talking about hemispheric collapse, we need to talk about overshunting as well. So overshunting means that we drain too much CSF in a too small amount of time. And this can happen either during your surgery, when you put inside the ventricular catheter and you drain too much CSF, or it can happen if you put in the whole shunt system and it drains too much CSF over a too small period of time. So what happens first is the lowering of the interventricular pressure, and that can result in negative pressures, which we know from human medicine. And if humans are presenting to the doctors with a headache and they are known to have a BPS implanted, they will go for diagnostic imaging. And what they may see is something like a venous vessel congestion, which might be looking like this. So they see a hyperintensity right underneath the skull and between the hemisphere and the skull. They might also see the concave ventricle form, and this is an indication for overshunting, an early indication for overshunting in humans. But in animals, we don't see that early signs because they present much later. So what happens when we drain CSF as one of our compartments in the cranial cavity? We give the other compartments space to increase. And if we drain too much CSF too fast, the first thing to increase, according to our Monroe-Kelly doctrine we are all familiar with, is the blood. So congestion of the venous vessels happen, and if there is too much increasement, these vessels may rupture. By rupturing, they will cause subdural hemorrhage, as we can see down here. So we see maybe a mixture of blood and CSF, which is compressing our hemispheres and result in hemispheric collapse. And as a consequence, brain edema may occur and ICP will rise. So this is one of our problems. And if we talk about overshunting, we need to talk about pressure and flow as well. So in humans, it is known that we have a so-called siphoning effect, which means that the perfusion pressure is not longer only dependent on ICP and the median arterial blood pressure, but now by in our shunt system, we have to deal with the abdominal pressure and the hydrostatic pressure inside the system as well, which is altering our ICP dynamics very much. So manufacturers know about that problem, and of course they came up with a bunch of valve system to overcome that. So to get rid of these hydrostatic forces, they designed a gravitational valve. They also designed differential pressure valves. And we want to talk about these two systems especially because they were part of that study. The gravitational valve consists of a differential pressure unit and a gravitational pressure unit. And if you imagine a human lying, the intraventricular pressure needs to get high enough to press down the first system, the differential pressure unit. This consists of a spring coil and a ball, and if the pressure is high enough, the ball is pressed against that spring coil and the CSF can flow through the whole system. This is the lying position. If the patient stands up, again, we have the intraventricular pressure overcoming the resistance of that spring coil and flowing through the system, and it stops at the gravitational unit. Because now the pressure needs to overcome that force as well. So these ball systems have to be pushed upwards in order to make CSF flow again through that system. So we have two different pressures in here, which make sure that overshunting will be less in these patients. If you have a close look to the differential pressure valve, you recognize that it's only consisting of a differential pressure unit. But this spring coil can be set at different resistances, and this is 5, 10, and 15 centimeter H2O, which need to be overcome to make CSF flow through the system. And a question you could ask is, are these theories translatable to dogs and cats or to animals in general? Because as you can see here, our ventriculoperitoneal shunt is aligned in a horizontal manner and not in a vertical one. So the distance between the entrance of the ventricular catheter and the entrance in the abdominal catheter is not high as in humans. And we have to take into account that we have very different sizes among our breeds. So doing that surgery in a Chihuahua might result in a different distance as doing it in a Ridgeback or in a Great Dane. So maybe we see some differences among different breeds. So this is one of our questions in that study, if we have different hydrostatic pressures among different breeds. Humans already looked for risk factors for overshunting, and they found out that chronic ventricular dilation is one of them, as well as post-hemorrhagic hydrocephalus and hydrocephalus due to neonatal meningitis, which we rarely see. And as we just talked about the different system, the use of low pressure valves was one of the risk factors for overshunting related complications. So our study design focused on the hemispheric collapse, and we did a retrospective evaluation of dogs and cats with internal hydrocephalus that received a VPS system. We looked for the prevalence of overshunting related complications, and that includes subdural hemorrhage and hemispheric collapse. And we performed a risk factor analysis with a logistic regression. So we looked for age, weight, as we just said, small, medium, and large breeds. We looked for the sex and the body weight. And furthermore, we looked for the number of affected ventricles, the amount of ventricular dilation expressed as ventricle-brain ratio, and we looked for the intraventricular pressure, which was measured during surgery. And of course, we looked for our implanted valve systems. We noted the duration of deterioration after VPS implantation, and we looked for clinical signs before implantation of the VPS system at the time of hemispheric collapse, and we performed another surgery to decompress the hemispheric collapse, and we looked at the clinical signs and the outcome after that surgery. And now you're all curious about to know what kind of surgery we performed. So here you have an example of an hemispheric collapse. You see the CSF and the hemorrhage compressing the hemispheres. So we performed a bilateral craniotomy, just a small drill hole at the level of the parietal bones to drain the fluid, as you can see over here. And in case of foraminal herniation and compression of the brainstem, the animals also received a suboccipital craniectomy to get rid of the pressure over here. But how did we recognize the hemispheric collapse in our patients? So usually the animals do very well after the implantation of the VPS system. So they start to get neurologically better day by day. And then all of a sudden they start to show alteration in their mental state. They show gait disturbances, vision deficits. And they may show an absent physiological nystagmus or a sudden pathological one. And on rare occasions, they also exhibit Cushing's reflex. So here you can see one of those animals with hemispheric collapse. You see the ataxia. You see the animal with a reduced mental state. He's disoriented, has some vision deficits. Unfortunately, he hears German voices as well. And then he falls down. So this is what you see clinically. What you can also observe is that the CSF reservoir, which we implant with every VPS system, is not filling anymore. And you can see it over here. It's consisting of a small metal plate and a plastic chamber underneath. And usually if you press it, you feel it refilling again immediately after. If that does not happen, it speaks for malfunction of your ventricular catheter. And in case of hemispheric collapse, you can see it over here. The reason is that the cortical mantle wraps around the tip of the catheter and the CSF is not able to pass through it anymore. So this is one of the most indicative signs you can see. Besides surgery, we had 15 animals with hemispheric collapse in our study, and 10 of them received that decompressive surgery, which we just talked about. And of these 10 animals, 8 improved. And with improvement, we mean they got better than after or than before presentation for the implantation of the VPS system. So better than before presentation. So if we talk about 8 of 10 animals improving, this leaves us with 2 animals that did not show any improvement. And they consist of one Samoyed who was not showing an improvement and who showed unchanged clinical signs in form of ataxia, vision deficits, circling, and strabismus. And one European short-haired cat was progressing to a comatose state after 5 days, and the owner elected euthanasia. So coming to the surgery then, the time to deterioration was about 19 days, and the drained fluid was about 15 milliliters, as you can see here as well. I just want to give you another example of one of our cases. So this was an Italian greyhound that was presented because of intermittent circling, intermittent behavioral changes, and altered mental state. You can appreciate in the first row the dilation of the ventricular system and the deformation of the interthalamic adhesion here. So this dog received a BPA system, and 4 days after implantation, he was luckily still hospitalized because that was the lucky one with the Cushing's response. So we immediately went to MRI and we got that pictures in which you can see that the hemispheres collapsed. So you see the concave form of the ventricle, you see the subarachnoid or subdural hemorrhage and CSF over here. As we already talked about, the ventricular catheter is stuck inside the parenchyma, so CSF is not able to flow, and the pre-check was not refilling in that patient. And what we also can see is a foraminal herniation over here with a severe compression of the brainstem, which is very likely to be responsible for the Cushing's reflex here. So we just obtained these images, then went into surgery right away, and we did the decompression we just talked about. He also received the suborbiter craniectomy to get rid of the compression here. And then the dog improved day by day, and 3 months later he came back for a recheck, neurological examination and MRI, and this is the pictures we got. So we see that there is still some hemorrhage left here and over here, but the ventricular catheter is inside the ventricle, a little bit in the third ventricle, but CSF is able to flow and the pre-chamber fills again after pressing on it. And what you also can appreciate is that the cerebellum, the brainstem, look happy now. And what we also can observe is that we have, at least to some degree, a reconstitution of the parenchyma. So you can see that the brain parenchyma over here and over here is a little bit more than in the first pictures. So this is what we want to see after the surgery. And most important, the dog is neurologically completely normal. And now we come to the hard facts you're all waiting for. We include 82 animals in that study, which leaves us with 75 dogs and 7 cats. And the prevalence of overshunting was 18%. We could not identify age, body weight, or breed as a significant risk factor. And we could not see a significant influence of ventricular pressure or our implanted valve system. What we were able to see was that biventricular hydrocephalus carried the most risk or the highest risk for overshunting related complication, which means that if you are a dog and your lateral ventricles are affected, then you have a high risk of hemispheric collapse compared to a tri- or tetraventricular hydrocephalus. The same is with the ventricle-brain ratio, which is basically the amount of ventricular dilation. So the higher the ventricle-brain ratio, the higher the ventricular dilation, and the higher the chance for hemispheric collapse or other overshunting-related complication. So to summarize the important things, we have no difference between gravitational and differential pressure valves, and we don't have any differences among the differential pressure valves. So there's no difference among 5 to 15 centimeter H2O, which was all implanted in the study. And we did not see any difference between small and large amounts, which, if you remember the discussion from the beginning, is very interesting because it tells us a little bit about the value and role of hydrostatic pressure in these animals. What we were able to see is the number of affected ventricles and the degree of ventricular enlargement as a risk factor in these patients. And I think most importantly is the fact that hemispheric collapse has a very favorable outcome after decompressive surgery. So as we said before, these animals were put to sleep usually. And as you can see on that little guy, you know from the video before, it's not necessary. So they can have a very good quality of life after the good decompressive surgery, and they don't need to receive euthanasia. And this is not important to know for us, but we should also discuss it with owners who are coming to us for the ventriculoperitoneal. Now, having a look on the human risk factors, chronicity of ventricular enlargement was no risk factor in our cases. We didn't really look for the chronicity, but as the congenital hydrocephalus is ongoing birth, we know that age is no risk factor. We can assume that the chronicity does not play a big role in these animals. The pressure valves was also no risk factor in our study. And as we just said, post-hemorrhagic hydrocephalus and neonatal meningitis is not evident in our animals. At least we just see very few post-hemorrhagic cases or evidence of hemorrhage in hydrocephalic patients, at least in animals. So we had a few study limitations we just want to briefly talk about. The main thing is given in the retrospective character of the study, so that leaves us with no medically treated control group. We had a very low number of cats, but if you listen carefully, we planned the study about 20 years and we were left with 7 cats. So doing the study only on cats would probably cost some more decades. And the limited information about CSF dynamics is always a problem in patients with internal hydrocephalus. And this is giving us some future perspective because we want to learn more about CSF dynamics. And this is why we started to implant a VPS system that have a telemetric unit implanted as well or integrated. And that allows us to measure intraventricular pressure on awake animals with internal hydrocephalus after the implantation of the shunt system. We are very curious about the results and we hope that we can serve you with some results in the future. And now I want to thank my team for clinical daily support, for the support with all the studies, and sometimes also for some emotional support. So thank you very much. And now I'm open for questions.
Thank you very much, Daniela, for this presentation. Waiting for some question to be put on the comment box. Just a you mentioned clinically some of the finding, and I remember vividly, and I don't know if you mentioned it as well, in dog with persistent fontanelle, one of the first signs we knew things were not going well was when you could see a dip actually at the level of the fontanelle, but the skin was sucked in like that. And it's something described as well in babies when they got complication due to overshunting. And I vividly remember a Chihuahua having this progressive dipping. Initially the nurse call you and say, oh, it doesn't look right, and you, yeah, right, and then it gets worse and you realize what's happening. I just had a quick question for you. Do you actually measure the CSF pressure within the ventricle perioperatively before shunting?
Yeah, we do it before the shunting, like when we do the anesthesia and we prepare for the implantation of the VPS. We do the drill hole, and right before insertion of the ventricular catheter, we are doing a measurement of the IVP by a special sensor system.
Okay. And have you seen, did you have case where, sorry, carry on?
Sorry?
No, sorry, I've interrupted you. What you were saying?
No, I just said that we measure the IVP right before we insert the ventricular catheters. We have a special system, like a special probe can insert, and we can measure intraventricular pressure by that. It's a Codman system. Don't know if you heard it.
You haven't seen any correlation with the rate, the complication, overshunting, and having
the Chihuahuas and the Fontanelles?
Sorry?
Or with the IVP, you mean?
With the IVP being,
No.
high, if it's very high in some dog.
No,
Before
so
there was no correlation at all.
We for that, like one of the interesting things is that we observe a lot of normal pressure hydrocephalus. So there are only a few who really experience pressures above 12 millimeter Hg. And a lot of Chihuahuas, for example, have pressures around 4 millimeter Hg. And the IVP was no risk factor in that study, no.
So you're saying that some of these dogs had actually normal intraventricular pressure. That's the main.
Yeah.
And in this case, what would be the benefit actually to shunt? Because the shunt is to try to regulate. So what is the indication of shunting them if the IVP is normal?
The indication for shunting should be the clinical signs, because as we know from human medicine, normal pressure hydrocephalus can also result in clinical sign, and this is the Hakim's triad in humans, which consists of cognitive impairment, which is gait disturbances and urinary incontinence. And we don't have such a defined clinical syndrome like Hakim's triad in humans, but when we see clinical signs that match with the finding of hydrocephalus, then I think we should do the VPS treatment.
Okay.
But the recommendation has to be established now.
Sure. I'm afraid there is no question so far. Simon, did you have anything you wanted to ask Daniela?
Yeah, I've got a couple of questions for you. One of your signs of concern is seizure activity, and your group have shown that seizure activity is of quite low prevalence with hydrocephalus. If you just saw seizure activity after the surgery, when would you step in and say we should re-image this patient? Do you have to have other signs as well, or in a patient that hasn't had seizure activity before, is the presence of seizure activity on its own enough to say, right, we've got a concern, we should re-image for the potential of a collapse?
Yeah, well, seizures are not that often observed. So if you read the paper carefully, we had some patients also seizured, but they seizured before as well. They may be just increased in their frequency. So usually seizures are not one of the common signs in hydrocephalus. Like we did another study on that in which the prevalence was very low. And I think usually the animals may have any other cortical abnormality. This might be neuro, which is also very often present in animals that may also be affected by increased or large ventricles. And interestingly, the implantation of the shunt system is associated with seizures in humans, but not in animals. So we don't know why, but it doesn't seem to play that big role.
Yeah, that was my interest, was whether the surgery itself could increase the prevalence of seizures, and so we would just have to expect this, maybe prophylactic medicate, or just the sheer presence of a seizure post-surgery concern you?
If seizures occur after surgery, my recommendation would be to do another MRI just to exclude any other cause for the seizure events. And yeah, if you don't find anything else, then you have to think about the shunt system as a possible factor, but it really doesn't happen. But you potentially have a neuro or something like that.
There is a couple of questions I'm going to put forward from Anna. Any infection problem over time? Did you have, in comparison, is infection more or less common than overshunting?
Luckily, we just have very few infections. So I can remember like 2 or 3 patients over the last 10 years. So I think the prevalence is somewhere at 1 to 2%, but we didn't calculate it now. In humans, especially in children, these infection rates are much more common, why there is also a need for antibiotically impregnated shunt systems, but we really don't need to use it because infections are very rare.
Good, good. And probably the last question, I think, Kalwan from Bulgaria, it would be a good summary for any of our listeners that are the case and planning to do shunting. I mean, what have you learned from your study to actually limit this complication?
So I think it's hard to limit the complication because if you have a patient with enlarged ventricles and it's ventricular and has a huge VBR, I think it's all about the owner discussion, because on the one hand you can say, okay, we don't want to try this or want to get a chance, but with the knowledge of the risk for overshunting. But I think the important message is, even in case of an hemispheric collapse, these animals don't need to be euthanized. So it's not really that we can recommend one or the other treatment. Maybe in cases of very severe ventricular enlargement, one could take into account the clinical signs and see if they are severe enough to force the surgery. But
very good. Thank you very much, Daniela. I'm sure everyone has enjoyed it, and thanks for taking the time tonight to show the result of your publication. Simon, I'll leave you the last word.
Yeah, thank you very much, Daniela. Excellent presentation. Thanks to you and the team for putting that together, helping us out. As we said, this is the last Facebook webinar session for 2023. If you have a research study underway or a publication coming out soon, then please let us know if you would like to sign up for 2024. Thank you to tuning in today. Thanks again to Hallmark Veterinary Imaging for sponsoring this, and we'll say goodbye and thanks again. Bye-bye.
Thank you. Bye.
thank you. Bye.